Hello, guys. Hello, guys.
Hi.
Hello, guys.
Hi.
Welcome to our YouTube channel. Welcome to Doctors Unhinged. Today's podcast theme is going to be about two things. The first thing is the myths, the mammograms, and the melons. The second thing is... Well, come on. You kind of ruined that. You're supposed to jump
I'm
on
sorry. Prostate cancer. We're talking about prostate cancer.
And
We're not discriminating nobody.
Yeah. We're talking about the two most popular cancers in men and women.
Yeah, for sure.
But isn't lung cancer at the top?
Second for both, actually.
Also, it's breast for men, for women, and then
Prostate for men.
and then lung cancer second. And then next is colorectal, right?
Well, I mean, they change also with different regions in the world.
Right.
But arguably, top for each is breast cancer for women and then prostate cancer for men.
Sweet one. So, we're doing this episode as like a 1 and 2 because prostate cancer month is November, and then breast cancer month was last month, which was October.
Pink October.
Yeah, Pink October. So I will obviously
voice
be
spreader.
talking. Oh, sorry about that.
Yeah, man. Ish.
Sounds a little nice though, you know. It's like a Questa type.
Literally, I'm gonna milk this voice,
bro.
I'm not even trying to sound like
song
this.
should be out next week.
Yes. I hope if you can stay until the award show.
Oh yeah.
Yes, because somebody got nominated.
Somebody got nominated.
Yeah.
Let's get that. Whoop, whoop, whoop. Yes, our lovely Dr. Mayamba has 4. He got nominated in 4 different categories. Let's go there. Let's vote. If you want details about it, you can find it all on his page.
Check on my page. Check on my page.
Yeah. Send those
do the
SMSs,
right
guys.
thing, man.
It's only 50 tabe for SMS, isn't it?
It's $2, but
$2.
support local, guys.
Yeah,
Support local.
If you buy
Also
10 airtime, vote 5 times, you're good.
Yeah, just also listen to it before you do. Don't just do it because we said that we should. If you genuinely like it, feel free to do what's
I've got
needed.
a favorite song from the album as well.
Really? What is it?
You know I've got a favorite song from the album.
Stand Sami. Yeah, it's a beautiful gem.
Oh man,
Beautiful gem. Radio loves that record.
Really?
Yeah.
Oh, it's such a lovely gem. What language is that?
Bemba and Nyanja, I believe.
Yeah.
And then a little Sitana here and there.
Yeah,
on my
there's
verse,
some
but-
song there. Yeah, that was it's lovely, man. I played in my car, like, jamming it. Such a good song.
How are you?
I'm great. I'm great, actually. I'm very happy. I came in here actually with my energy levels on a very, very low.
Really? On a low?
Yeah. I was like, I was having an okay day.
Was it busy at work?
Yeah, work was actually not too busy. But I actually stayed over to work an extra hour. The doctor that was coming on took a bit of time, and then he had a client that he was uncomfortable seeing, so I had to see the client. Which, by the way, interesting fact, doctors do reserve the rights to reject patients. Like, if a doctor doesn't want to see you, he can say, I don't want to see you. I was about to say piss off, but I think
technically
it's
did,
not a kind thing to say. But yeah, he can actually say that.
I think under the guise of doing no harm.
Yeah.
Because if there's
like a conflict of interest or something.
Yeah, you're not gonna be level headed throughout. So might as well not.
Yeah.
I'm actually tired,
Oh man.
Like
Well,
I can't
hear
even
it from your voice.
Yeah, I can't even chart it down to work or like the musical career. I think I'm just tired. I don't know if it's end of year burnout or so much so that I'm doing the hypocritical thing.
That's soft launch.
Yeah, I am not by any means supporting or promoting this brand. It's just that I need to stay awake. So also it has 0 sugar. So
Oh really? You got the 0? It tastes terrible.
I know, but diabetes and thing, we have to be proactive. I can't be hypocritical about everything.
Oh okay. So you decided to choose one struggle.
Yeah. I'm recovering. And I'm here to show you guys, on cam that I am recovering and working through it. But you can hear how I sound, man.
He's too tired.
Oh Lord, have mercy.
Every time I drink a Monster, Dr. Mayamba made this song when we're in uni. It's called Realist. And in the song, there's a line where he says, "Battle turned me in." Wait. No, how can I hear it? Battle turned me in. No. Came out with 3 scars. The battle turned me into a monster.
Yeah. I actually forgot about that.
I was like, how crazy. That's a crazy line.
Yeah.
Because I had to listen to it 3 times to get it. Because 3 scars, it turned me into a monster. 3 scars turn into a monster. I'm like, the drink, that is crazy. That was absolutely awesome. That's
I
actually
think you
my
saying
all-time.
it now is me clocking that. Because, you know, sometimes, like, when these things happen with, like, the nominations and stuff, I've never submitted for anything. This was the first time.
Right.
It, to other people also that don't know, it's like, oh, okay, you submitted, you make music. But, like, now I'm clocking, like, it's been a while.
You've been making music for a long time.
Like, for a minute, so we'll see how it goes, man. Vote. Let's bring it home. On to the actual topic of today, breast cancer
and prostate cancer, right?
Which are a prevalent thing, you know, more than anything, breast cancer. I have a question for you. Just because as a woman I have a breast lump, does it mean I have breast cancer?
No, but it means you should see a doctor.
There you go.
Right. You should see a doctor. And so I think the way that I'd agreed to structure the episode is that Dr. Mayamba is going to talk about prostate cancer, and I'm going to talk about something that everybody loves, or at least has an opinion about, which is breasts. Because I figured saying boobs is going to be inappropriate for the thing.
You think your inner thoughts, yeah? And then you tell yourself not to, and then you still say at the end of the day, mad.
Yeah. So this is in honor of the Breast Cancer Awareness Month, right? So breast cancer is the most common cancer among women worldwide, right? But the good news is that early detection literally saves lives.
Yeah.
Right.
I think if it's not 90, it should be 99% from the last stats I read.
Right.
Early detection will result in like 99% reversal. So
right. So you're encouraging all the ladies to do that breast exam every once in a while when you're coming out of the shower. So, and you're right, if caught early, survival rates are over 90%, right? So 5 minutes in the shower just doing a self-check might actually be the most important 5 minutes of the month. Do you know what I mean? So you guys take that seriously.
Yeah, I think they do recommend it to be done once a month. Yeah, it's like do the self-breast examination
once a month, because it takes literally takes less than 5 minutes, and this is without any discrimination, right? Men can get breast cancer too. So you know, when after you've walked out your chest day, just go there, just by the mirror, and just, you know what I'm saying, feel it. That's what I do in the mirror at the
do gym. You check?
No,
for lumps, honestly, or you're just feeling for the gains?
I'm just massaging myself after a good workout, and I'm showing off by the mirror. But it doubles down as my breast exam. So.
Yeah, 2 for the price of 1. Men do have breast tissue, as well, but it is rare. Like very rare to get breast cancer. But we're not gonna sit here and say that it's impossible to get it done.
Speaking of physical exams to check for cancers, is there one for prostate?
You know what it is,
so funny, though.
You know what it is. You know what it is. I think on the course of shooting the pod, we've discussed and like addressed men not coming in to consult on time. Be it like social, be a man, this, that, and the third. Stop. It's how we have the energy to say it, but stop it. Stop that thing. Literally, we have made progressions in medicine. Historically, there's the DRE, the digital rectal exam.
Yeah, digit meaning finger.
And then rectum meaning rectum, and then exam. So they stick a finger in a very dark place to feel for your prostate. But, it's 2025. We don't need to be doing that anymore. Although some doctors still prefer to do so, there is a simple blood test called a PSA that can assess for... Pretty much it's used as a technique for screening for prostate cancer.
I'm sorry, I'm going to interject.
Yeah, what's up?
In uni, we had a urologist.
I refused to do that thing. I sat at the back. I remember what hospital it was, but it was the one on top of the mountain. Poms, yeah, I refused. Because we get there and then we're being told, it's urology.
Yeah, it's urology. You've got to check.
And you have to do a DRE.
Bro, you know what happened, huh? I got there late once with my crew. Because, we were like arriving in our little car. And then we get there late. I park like... and then get there, jump into the class, and you're still like wearing your lab coat as you're running in, because the teacher's very scary. One thing about like surgeons is that generally they're like the scariest professors that you've got, right? And then I'm the last one to walk in, and then it says, right, you come here. Like, no problem. He's like, get the glove. He's like, this is our patient. And he says, we need to check his prostate. Have you done a DRE? He was like, never. No, I've never done it. He says, I'll guide you through it.
Oh, you did a DRE?
No, I didn't.
Oh, hallelujah, man.
I didn't. I didn't. 'Cause luckily, you can actually just say, no, I'm uncomfortable doing the procedure, and then not do it. It's just, it looks really bad because if he had taken me for exam, he's going to remember that I'm the one that said
no to doing
I'm
the
not
DRE.
doing- yeah. But yeah, that was the punishment for being late in class.
Yeah, also just Russians in time was like a thing, man. Like
Yeah.
you would get proper punished for not being on time.
Yeah, it was.
I just thank God that I never had to during med school, and now that we're done with it, I have the power to say I'm not going to.
You're not going to.
Also, just get a prick test. If I recall,
Mm-hmm.
Diagnofirm does offer free PSA testing in November. Just go to Diagnofirm or go see your doctor.
Yeah.
Ask the questions you need to. Even if you're not a medical aid, it's entirely covered for. Because again, we're always saying this, mate. Like, prevention is better and cheaper
Than cure.
Having to go through the runs of cancers is not a fun thing.
Yeah.
And earlier with, because I'm going to segue it, there's they have, just because your PSA is slightly high doesn't mean you have prostate cancer, right?
Yes.
Ultrasounds are there to do further testing, as is with women. Just because you feel a lump doesn't mean you have breast cancer. It literally could be, in most cases, a fibroadenoma, which is a harmless, benign lump.
Right.
They do go away sometimes on their own. If they're too small, no surgeon's really going to want to open and search for it.
Right.
But surgery usually takes care of it if it's causing you pain and for aesthetic reasons, if it's distorting the breast.
Yeah.
And with men, you have benign prostate hyperplasia.
Right.
Just means your prostate is
big and
swollen,
enlarged,
but it doesn't necessarily mean that it's cancer.
Yeah.
So that's why screening is important, man. Like, you can't. There was, I think with the conversation I had with man Noah Simon, HIV advocate, we were discussing how if you're going to stigmatize against people that have HIV, you might as well stigmatize against people that have high blood pressure or diabetes.
Right.
And at the end of the day, they're all taking one pill to kind of keep things in check. I was like, if you put 10 people in a line, regardless of how trained you are as a medical doctor, and I was like, okay, pick out the diabetic, pick out the hypertensive, pick out the guy that has prostate cancer, pick out the guy that has breast cancer.
Right.
You can't. And that's why we're always encouraging screening. You don't need to be sick to come see Dr. Michael.
Right.
Sometimes just walk in and bring him lunch. Like, listen, I like that thing that you spoke about on the podcast.
What's that thing the 2Ks do?
Clock it.
Yeah. Bring lunch.
So screening is primal. It is painless. I mean, obviously there's a needle, but it saves you so much time and so much money.
Yeah. Also, there's a caveat, right, to screening, is that I think you can't have sex for 48 hours prior to screening with the prostate, and also you can't do vigorous exercise because then that kind of throws off your PSA.
Your numbers.
Value. But it's a small thing to know. That's why also it's important to just pop in by the doctor first and make sure that you're not doing it. You're not just going to pay for a test that you might have to repeat after a couple of days.
Classically affects men over 50.
Right.
I'm talking prostate cancer. I was just jumping between topics. And with, if you have an immediate family member that had it, then from 40 up, you should. But now, you see, the question then becomes, if I'm a 32-year-old or a 21-year-old, and I hear, oh, prostate cancer's there, does it make sense to come do it? And I'm opening this up to, like, me and you to chat about it. Okay. What would you say if I come to you, right? I'm a 21-year-old, and I'm like, Dr. Michael, I'm not sick. I just came in to screen for prostate cancer. And you check the information in the computer, and I'm 21.
You're 21, right? Do you have a family history?
No, but my best friend's dad had prostate cancer, so.
Okay, all right. Then are you having any symptoms?
Nope.
So you're not symptomatic,
I'm just chilling. I just want to check.
All right. Sorry. And not at this time, right? Your time for checking will come. but if you do develop any red flag symptoms. So what we do in cases like this, right? So it's not every time you go to the doctor that the doctor's supposed to give you everything that you want, right? Sometimes the doctor can advise against.
It's not a restaurant where you come and order
where you
things.
come and say, "I'll have 3 X-rays, 2 ultrasounds, and
they be doing that, bro.
They love that, yeah. Like I've had people come in and say,
Jarring.
"I'd like a psychology referral." Why? Because I have to decide. I have to write something on that referral. I don't just write, "Help her, please." Do you know what I'm saying? I have to write, "Okay, this patient has come to me with 1, 2, 3 symptoms. I think this patient has this type of psychological illness that might need some cognitive behavioral therapy with a psychologist." It's not on request. That, I feel like seeing the psychologist, let me go and see the doctor, so he patterns it. It doesn't really work like that. But yeah, so in this case, right, we try to list red flag symptoms, right? So I'll go through some questions like, is he having a problem with peeing? Is he having a problem with urinary retention? Is he having recurrent, infections and things like that? Is he peeing at night? He's having what's it called? Streaks, isn't it? When it's... Yeah, it's just like, right, and things like that. Ask him about his family histories, if he's at risk and things like that, right? And then because it's a screening test that we have to bill the medical aid for, they come to us and say, "Doctor, he's 21. Why did you do that?" Right? What guideline are you using to do that? So now they're questioning my medical practice because I'm just the doctor that just signs things off. So the thing to do here is, again, go through it, make sure that he's at risk. If he is, we can test it, but 9 times out of 10, he's probably not, especially given his age. And then we'll tell him to wait and say, "Okay, listen, how about this? Whenever you're 40, you're getting close to 40. How about we check it then? 45, do you know what I mean? If you develop any symptoms like 1, 2, 3, how about we check it then? If you're at risk of certain conditions, how about we check it then?"
Remind me to ask you, how do you feel? I'll remember.
Okay.
Just remind me to ask you this.
How do you feel?
You know what it is, right? That's why guidelines exist.
Yeah.
So that everybody around the world isn't just doing what they want to do and we're all following some sort of systematic approach.
Right.
If you come in with a headache, what's the reason that I'm doing an X-ray of your knee?
Right.
Right? Like there has to be some correlation. Like even if I'm sending you to the lab or to do a scan, they would need some sort of history to say, "Oh, okay, dislocated this, that's why we're doing this,"
something
right?
to substantiate that procedure.
Yeah, so historically, the chances of you getting prostate cancer at 21 are almost zero, right? What's the point in doing it? Like, it's not just, like I said, it's not spa or pick and pay or Choppies where you just go in and pick out what you want because you're paying for it. And this is why I was bringing it back to say, I think there was a patient, I forgot what they were asking me about. They wanted to do some test. And I asked them rhetorically, I was like, "Okay, when was the last time you had a chest x-ray?" And they're like, either I don't remember or probably during COVID. I'm like, "Okay, so why did you get the thing done?" I know I was having pain in my chest. I'm like, "So you haven't had an x-ray since then, why?" I guess I didn't need one. I'm like, there you go. If you're a guy that works in the mine, I understand why we're doing annual chest x-rays. But don't forget that, as we've discussed this before, medicine isn't entirely harmless, right? Same with the antibiotic chat that I'm not going to go into detail because production might clip this moment. And then we're going to trend again over something that was taken out of context. But not everything is entirely harmless. We're just exposing you to radiation for nothing because you want to.
As per request, yeah.
And this brings me to what I was saying to you about how do you feel about your medical educational opinion being questioned directly or indirectly?
I try to welcome it as much as I can because I do this thing. I even write it now in the patient notes called ICE, where the I is for ideas, right? What ideas the patient has about their illness.
Right.
And then the C is for concerns. What concerns has the patient come to me with? And then the E would be for expectations. So what do you expect from this consultation? And sometimes I'll literally ask it just like that. Like, what were your expectations when you came in here? All right. And then we can sort of, because then that gives me an idea of what the patient has, what preconceived notions the patient has come in with. And that way we can move from there, whether it's by education, whether it's by reassurance, or it's by actually doing some tests to find out what's going on. right? I did a bunch of swabs today.
What kind? Throat swabs?
Yeah, the throat swabs. I had quite a number of patients. I've had quite a number of patients with acute tonsillitis.
I think I might be coming down with something in my throat as well.
And so with acute tonsillitis, right, the way to diagnose it is really simple. There's something called the Centaur's criteria, right? It's 4 things that you basically have to have, like the tonsillitis. You have to see the tonsillar exudate, so you see like the white bits on the tonsils.
Stones on it.
And then they have to have fever. They have to have no cough.
Yeah.
Right? And then the last criteria is that they should have lymphadenopathy, which is like pain when you touch their lymph nodes, right? So when you've got 4 of those, 80% of the time, it's probably acute tonsillitis. So then we'll treat you with an antibiotic. We'll give you some medications to manage your pains and things like that. And then from there, I had a few guys that were treated, but they were given a shorter course of an antibiotic or like a sub dosage from a different clinic. And now that they've had that, I don't want to start them on another antibiotic before actually confirming sensitivity, because I don't want to risk him having colitis, which again is a big thing. When you're mixing antibiotics, you can get like a crazy diarrhea that doesn't really stop. So I was like, okay, another swab, let's do it. And then we get for culture sensitivity and waiting for them.
You know what? I'll give it to the patients, because once you explain to them, they tend to be understanding.
Exactly.
Like for things like UTIs, right? Mm-hmm. A woman will come in with all the symptoms and she'll tell you straight away that, listen, I have a urinary tract infection. Me, I'll ask you, okay, what makes you think that you have one?
What brings you to that conclusion?
Like, how did we get here? Right. No, I'm peeing more frequently than I normally do. It burns when I pee. Yeah. My urine has red a funny smell. Or I notice blood in the urine. And I'm like, okay, cool. And then walk them through everything and then say, okay, listen, I'm going to send you to the lab and then we're going to do an MCS. Right. Microscopy, culture, sensitivity. And they would come back and say, but why don't you just write me antibiotics for it? I'm like,
which ones?
Now, I hear you, right? But then there's so many of them. And you know the rule. Once you start with antibiotics, you must finish the course. Now, God forbid I write you something that this bug is resistant to. Then you're on a course of meds that you have to finish, but they have no effect on you. Or we could wait one day so that we know exactly what bug
we're treating.
It is,
we'll
right?
Just kill it one time.
So it becomes a thing of there's a right thing to do. And then there's just, because we have limited resources, we just do what we can. So again, I'm not necessarily against blind prescription of antibiotics. Limited resources, I've been in the same position. I've had to I'm like, okay, Cipro. Let's do the quinolones because 90% of the time it is sensitive, right? But then I've had patients that I sent for MCS that came back resistant to Cipro. So same thing that you're saying. Ideally, in a perfect situation, and hear me clearly here, when you come in with a throat issue, the ideal thing is for us to get a swab and send it to the lab. That way we can actually tell your throat issue, is it viral or is it bacterial? Half the time we just wing it and
check up.
Like here, I think it's going to need antibiotics.
Statistically, also to save time and resources.
Yeah, so there's a right thing to do, and then there's
the standard thing to do.
Exactly. So sorry that you had to do swabs, though.
So no, it was all right. It was a few of them, but then I was just saying, like, in this case, because then you want to be in a position where you do less harm and more good, right? So I thought it right today. So I was just doing a bunch of them, and then like the lady that works at Diagnopharm at work is just like, yo, so much. So much when we're doing those. But yeah, right. Listen, we've had so much chat about PSAs. I'm gonna do a quick myth and fact, right? And then so you're just gonna like tell me myth or fact.
I mean, I have one fact,
which is
I kind of touched on the myths already. The first diagnosis of prostate cancer was by Dr. John Adams, 1853, a London hospital. They were dealing with a 67-year-old patient that had urinary obstruction. And that was the only presenting symptom is, well, he couldn't pee. He wanted to, but he couldn't, right? Unfortunately, he demised.
Okay.
And upon doing the post-mortem, they realized that there was this irregular, hard prostate with metastasis to the pelvic lymph nodes. And then they do the biopsy and then confirm that it's a carcinoma. Now, this is 1853.
Yeah.
So before then, there could have been multiple cases, just that there weren't enough diagnostic tools.
Yeah.
So 1853, Dr. John Adams, surgeon at
London Hospital.
Okay. That was the first case. It's pretty interesting that, and this, this is the other thing that, because we've chatted about it before. To all the patients, please, I'm asking, yeah? Be kinder and nicer to your doctors.
Yeah.
Because they walk in and kind of expect you to know everything. There was somebody that told me they had open heart surgery and a valve replaced and needed me to write them down medication. And I'm like, so listen, yeah? I went to school for 6 years. There's another 6 years to become a cardiologist, let alone cardio surgeon.
Yeah.
These are all different specialties. Yeah. I don't know enough about this to go in depth into it. Because sometimes patients will get mad at you about not knowing something, or when you want to refer to a specialist.
Yeah.
And so that's where the chat I was asking you about is, how do you feel when it's questioned? I don't feel no ways about it. I literally go, okay, so I went to med school for nothing. The things that I'm saying are just insane. Because again, I understand, for example, patients use certain language that doesn't translate medically. Mm-hmm. For example, kinalidi alsar.
Kinalidi low blood. Bro. It's good. People, so you're laughing because you're medical, you understand it, right? You can imagine how strange it was the first time that I heard it. Because you did your internship in Marina, you probably heard the statement be repeated loads of times, right? I get here and I'm practicing, somebody says I've got low blood. In them times, they're on high blood pressure meds. So I'm thinking to myself, what do you mean you have high blood pressure? Because she's like, can I BP? And kinali low blood.
Also, kinali BP means I have blood pressure, which everybody does.
Which everybody really does at the same time. But yeah, that was one thing. It was crazy. But you're acclimatizing, you learn.
Yeah,
but
you chart it down.
You're still saying that your patients have their own language.
Yeah. And it's just, it's nice to hear, and also just tell them okay, no, but it's not technically, because also would mean you have in your gut. Right, and the only way you're gonna see that is through a scope,
endoscopy, yeah.
Or they put barium and checked if it was leaking. Right. But we're dealing with heartburn. The other one, based on what you were saying, is patients will come in and tell you, "Yeah, can I lead you code? I have tonsils,"
and they're convinced.
And I'm like, "Yeah, no, we all do. Unless you had them surgically removed, we all have tonsils." But you understand they're trying to say it's a sore throat.
Yeah.
But then, you were saying, tonsillitis doesn't classically have a cough. Mm-hmm. Pharyngitis, which I probably have, has a cough. Yeah. So there's and now you see the many ways you can get it wrong, right? If I remain corrected, cardiovascular is number 1, cancers are number 2, and then medical errors is number 3 in terms of causes of death in the world. Yeah, medical errors is number 3. Because you could get it so wrong, brother.
And once you get it, and you know what it is? Pride as well. Once you've gotten it wrong, it's a few people that will come back and say, look, I screwed it up.
Exactly. Even with this case, urinary obstruction, you've never seen this thing before. Happening. Unfortunately, the gentleman demises, only we realize, it was cancer the whole time. So when you come in with one thing, you're vomiting, and you expect me to tell you exactly what it is, without running the appropriate tests. Or better yet, try and convince me that you know more about this thing than...
I think for years now. I know what it is.
Yeah, my thing isn't even that I feel a way about it. It's just, I understand how complex, how one symptom could be explained by so many things, that I'm afraid to speak with certainty. Yeah. But you are. And you
that's rule out red flags as well at the same time.
And that's what my conversation always is. I think my patients and even yours could testify that you want to talk to them through things. To be like, okay, how did we get here? I have no issues with you checking Dr. Google, but just because your head hurts doesn't mean it's a brain tumor. So
there's all that. All right, cool. I mean, we didn't get to touch a lot on breast cancer.
You had
so
myths.
Many puns, bro.
No, just run them through if you don't mind.
So time is up now, but okay, no problem. Don't mind.
There was a complaint on the last episode that the episodes are getting shorter.
Really?
Yeah.
Okay.
They don't even know. It's like we're gonna keep this one under wraps. They don't know the big news that's coming.
Yeah. We've got huge news coming. Oh, absolutely huge news.
Just,
I will not even say it because my production team is. You know what I mean?
We'll just keep saying huge news every episode
until we get to the news, right? Myth or fact? Wearing a bra causes breast cancer.
You know what my thing is with these things, yeah? Is there's proper people that genuinely believe. Okay.
But myth, right? The only thing that your bra causes is relief when you take it off. Shout out. The ladies can relate to that one. I'm telling you. Big shout out. Right? Yeah, so there's zero scientific evidence or a link between bras and breast cancer. Next myth. Well, no. There's myth or fact. Only women over 40 need to worry about breast cancer. No, right? So even women in their 20s and 30s can still get breast cancer, especially if there's like a familial
history
thing and history as well. You want to get that checked. I've had patients that have actually had to prophylactically remove their breast because they were at risk of a certain familial breast cancer.
Really?
Yeah. So like at an early age, I think one patient was around 30 and she had to do a breast ectomy, which is a breast removal. All right. And then again, last one, finding a lump means it's definitely cancer.
Of course.
Myth, right? I think we've talked about this one at the beginning, but yeah, there's like, it could be a cyst. It could be because of hormonal changes. It could be fibrocystic tissue, like what you said. But in any case, if you do find a lump, please come. Let me be the one to tell you if it's cancer or not. All right. Everybody's looking at me now. Everybody's giving me that look now that like I'm trying to do the breast exams, and this is all medical. Thank you very much, production.
You know,
team.
I'm going to say this on cam. Me personally, and I've said this to several patients that as uncomfortable as it is for you, it's equally as uncomfortable for me. Like when you come in and say I have a lump in my breast, I'm not being dismissive when I start filling out the ultrasound form. There was one patient that was like, aren't you going to like check? I'm like, so here's the thing, right? If we get 10 different people, it's going to be subjective. Everyone's going to feel something, everyone's not. But the scan's not going to lie.
It's not going to lie, yeah.
Even after this, we're still going to go do the scan. Or even with things like a woman comes in and tells you that I'm having this strange discharge. I'm like, walk me through it. Like, what color is it? What's the consistency? From your description, we can figure out what it is.
Do you know this is the enthusiasm? I was like, I will show you.
No, man. Like,
bro.
Like, aside from being medical, like, I'm a human being too, right? I have feelings at the end of the day. So it's like, because sometimes there's this like misunderstanding that every time you have something like that, there's only one way. It has to be checked or it has to be this. And then when you present an alternative variation, my patients never really complained because it was amicable on both sides. Like, we don't need to be doing this. Even if it came down to it, I'd be like, I go see gynae, because we don't. No.
Yeah.
No.
There was a doctor at our clinic who was doing it with chaperones as well. You'd ask the nurse to come and stand in the room, which is good, I guess.
I'm with that.
Case of because I mean, like, anybody could say, because it's your word against the patient.
Yeah.
Imagine, like, I'm not sure about the way that my breast was examined, you know, and then it's not looking good. So at least you have somebody to vouch for you. It works. So yeah, chaperones is a good idea. I always ask my patients if we're doing something as intimate as that, if they'd like a chaperone. Things like pap smears as well. We have a chaperone as well, just somebody there to sort of make sure that everything is going according to the medical standard, which is good. It's for their safety, it's for my safety, it's for everybody's safety, and for everyone to be more comfortable.
Absolutely.
Oh yeah, that's that. Let's wrap it up, man. How many have we done? Like 30 minutes now, probably.
Probably a little more with that.
That's enough. We've made up for that last short episode, guys. We're tired. You've seen that video where they go, they're tired, Shem. You can see them, bro. You can see the breadwinner. The breadwinner is tired, bro. So yeah, the breadwinner tired, guys. We're gonna be out. We're going home, going to gym. Are you going to gym?
Nah, man. I'm literally gonna try to deal with this.
Yeah, he's got.
Because I I was fine during the day, like at work and consulting.
Oh,
I don't know if I strained it during talking or it's the fluctuation in the weather. I don't know what it is, but...
Oh, sorry about that, man.
To be fair,
yeah.
I mean, it feels a bit scratchy, but I'm not minding the voice though. Like,
the voice is sounding very sexy.
I don't mind.
I'm with it. I say...
Also, I did my research.
And?
Because my one's from Saroe. You don't need to kill cows.
Oh.
To prove that you're a man.
Oh, okay,
Yeah,
okay.
That whole thing about killing cows.
The thing about... so you did a follow-up and you found out...
I had to, because I was truly concerned when you said, like, there's more cows than... God, what am I getting myself into?
Did she tell you that, like, you don't have to kill a cow when you come
I went to ask immediately. I was like...
You was like, yeah, what's going on?
Yeah, like, is this the norm back at the ends? Like, do I need to, like...
Yeah.
So I know I need to stack up on the allergics, because I was not joking about that.
Michael said to prove that you're a man... I don't have to kill the cow, but like whenever there's a function, usually the men gather by the cow and then they kill it. And so the most macho guy has the biggest knife and then he's the one that takes it down or whatever. So she said, if I'm trying to look good to the mandem, I should probably learn how to take one down. But I've got other means. I've got charisma.
Yes.
I'll buy them a crate. You know what I mean? Like, I'll say, guys, here's some drinks.
Yeah.
And once you're that guy that's like...
Found the loophole.
Yeah, that's your new niche because no one else is doing this. You're like, yeah. And then, once you're that guy, you can be like, right. Joseph, make sure the cow is skinned. I want that piece.
I think more than anything, charisma and enthusiasm.
Yeah, will take you.
I'm literally like, when it's time to like, to do the negotiation and because I'm trying to get married soon.
Big man.
Once it's time to do that, I'm literally gonna hope and pray my personality leads the way. I'm gonna crack jokes, banter.
They could charge you more because you're a doctor, actually.
You see that part, yeah? I don't know how we can like keep that under wraps. Might be a bit difficult.
I say quit and say like you're retiring from medicine a month before you go and pay, just so that when she gets there, she says he's a rapper. Not that that's not making money or anything, but like at least you have a second career to fall back on. Do you get me? Because you could be like, no, what is he doing? Now he's a rapper. And then it makes you look bad, but it's like, we're not going to charge him 10 cows. You know what I'm saying? We're going to be...
The thing is, it is a viable option, but I can just see myself sitting there. I'm like, yo.
Yeah, exactly.
Mic check 1, 2.
Yeah, with a durag.
Yeah. It's gonna be an interesting time. We'll do a recap.
Yeah.
Ladies and gentlemen and ladies, it's been fun.
Thank you, guys.
Yeah, we're signing out now.
We're signing out. Thank you for listening. Thank you for listening to the banter. We appreciate it. See you guys on the next episode.
You want to try it one more time? Because I seen that last episode. There was a lot that was happening with your sign out.
Really?
Yeah, with my one. What I'm always saying.
Oh. Stay happy and stay healthy.
I think you can make that one yours. Stay happy and stay healthy. Listen, man.
Drink water.
Mind your business.
Mind your business.
And be kind.
Be kind.
There you go.
Drink water, mind your business, and be kind. Shout out.